Welcome to our ground lesson on aeromedical factors. This is an important topic for every pilot, regardless of experience level. Our goal here is to understand the physiological and medical issues that can impair pilot performance and lead to dangerous situations in flight. For example, fatigue, dehydration, spatial disorientation, and the effects of high altitude on the body. Let's dive in and explore how we can recognize, prevent, and respond to these factors to ensure safe flight operations. When we talk about aeromedical factors, we're talking about how your body and mind can influence your ability to safely operate an aircraft. Why does this matter? Because even the most experienced pilots are still human, and our physiology can be uniquely affected by the flight environment. We categorize these issues into two broad types. First, aeromedical issues. These are medically related, like hypoxia, fatigue, dehydration, or the effects of alcohol. They can directly impair your decision-making and physical abilities. Second, spatial disorientation, which stems from illusions or confusion in your sensory systems. Your eyes, for example, capture the environment and send signals to your brain, so it can be interpreted to properly identify the aircraft's position in space. Your body is also capturing signals from your somatosensory system, such as direct pressures in your body and skin caused by acceleration, as well as signals from your vestibular system, the fluid-filled canals in the inner ear, which is responsible for the equilibrium. On the ground, these senses are very precise, but when flying in a 3D environment, some of these signals might not represent the reality properly, might get confused, and also contradict each other. Let's first talk about medical certificates, which are required in order to exercise pilot privileges in most certificates. The medical certificates are regulated by the 14 CFR 61.23 and come in three classes. A first-class medical is required for airline transport pilots. The privileges of the first-class medical expires after 6 months if you are at or above 40 years old, or 12 months if you are younger. A second-class medical is required when you're acting as PIC under a commercial certificate. So if you're flying for hire, the privileges of this certificate is valid for 12 months regardless of age. The third class is the minimum required for private, recreational, and also for student pilots to fly solo. Instructors also need at least a third class if they're acting as required crew member. An interesting fact: if a CFI is just instructing from the right seat without being PIC or a required crew member, a medical may not be necessary. The third-class certificate is valid for 24 months if you are at or above 40 years of age, or 60 months if you are younger. Here's an example. If you are 45 years old and have a first-class medical certificate, you can exercise the ATP privileges for 6 months. After those 6 months, those privileges end, but you still have the privileges of the second class. Here's where some people get confused. The second-class medical is valid for 12 months since issued, but 6 of those were overlapping the first-class privileges, so you would only have 6 months remaining with the second-class privileges. After that, those privileges end, but you can still exercise the privileges of the third class for the remaining of the life of your certificate. In this case, another 12 months. Now, let's talk about Basic Med. Basic Med is an alternative to medical certificates. If you held a medical certificate after July 2006, your last medical was not denied, revoked, or suspended, and you have a U.S. driver's license, then you are eligible to fly under Basic Med. It comes with limitations, which changed recently, by the way, such as the airplane cannot be heavier than 12,500 pounds and is limited to carry a maximum of 7 people in total. If you are interested in Basic Med, the first step is to bring a specific health checklist to your doctor and have that completed. Then take an online course, submit it to the FAA, and keep the course completion certificate, plus the health checklist, in your logbook. The checklist is valid for 48 months, while the online course is valid for 24 months. Medical standards are defined under Part 67, and some conditions are automatically disqualifying. These include certain heart conditions, like coronary heart disease or pacemakers, mental health disorders like bipolar disorder or epilepsy, and other conditions like insulin-dependent diabetes or substance dependence. However, not all hope is lost if you have one of these conditions. The FAA offers a process called special issuance under Section 67.401A. This allows the federal air surgeon to grant medical certification if your condition has been treated or is controlled in a way deemed safe for flying. These special issuances can expire and may require periodic follow-up. In other cases, where a condition is permanent, for example, like a pilot missing a limb, the FAA may issue a Statement of Demonstrated Ability, or SODA. This shows you've proven you can operate safely with the condition and typically doesn't expire unless the condition changes. Note that even with a valid medical certificate or operating under Basic Med, a pilot must always ground themselves if they develop a known medical deficiency that would disqualify them for a medical certificate. Now we will start talking about all the different aeromedical conditions that you as a pilot should be aware of. Let's start with motion sickness. Motion sickness happens when your brain receives conflicting signals about your body's motion. Your inner ear might sense turning while your eyes say you're stationary, or vice versa. Anxiety and stress can be contributing factors. Symptoms include nausea, dizziness, sweating, and vomiting. The good news, it's common in early flight lessons and often goes away with experience. To help prevent or treat it, open the vents for fresh air, focus your vision outside the aircraft, avoid abrupt head movements, and if possible, take control of the plane. Many students find that actively flying helps override the conflicting sensory inputs. Let's talk about hypoxia, the condition where the body doesn't get enough oxygen. We need to understand this because it can sneak up on us. It happens at altitude, and it is difficult to be noticed by the pilot. It impairs the brain, and last I checked, we need a functional brain to properly fly an airplane. There are 4 types of hypoxia. The most common in aviation is hypoxic hypoxia, which occurs when there's simply not enough oxygen in the lungs, like at high altitudes, when the air density drops and there are less molecules of oxygen for the same volume of air. Then there's hypemic hypoxia, which is about the blood's inability to carry oxygen at cellular level. This can be caused by anemia or carbon monoxide poisoning, for example. Next, stagnant hypoxia, which happens when oxygen isn't being delivered effectively, like a blood flow problem. Think of G-forces or heart issues. And finally, histotoxic hypoxia, where the cells can't use the oxygen due to toxins like alcohol or drugs that prevent the metabolic process. Symptoms of hypoxia include euphoria, poor judgment, slowed reaction time, and cyanosis. That's a bluish tint to your lips or fingernails. It can progress quickly to unconsciousness and death if not addressed. The best treatment is prevention. Use supplemental oxygen above 10,000 feet during the day or 5,000 at night. And if symptoms start, descend immediately and get on oxygen. Hyperventilation happens when you breathe too rapidly or deeply, blowing off too much carbon dioxide, and it is often triggered by anxiety, fear, or pain. This throws off the balance of gases in your blood, leading to symptoms like lightheadedness, muscle spasms, visual impairment, etc. The major problem with hyperventilation is that, in an attempt to stop you from breathing too rapidly, the brain shuts you down, making you unconscious, which is the problem if you're flying an airplane. If you or another pilot is hyperventilating, the treatment is simple but urgent. Slow the breathing. Encourage talking or singing out loud. Breathing into a paper bag could help, however, because sometimes hypoxia can be confused with hyperventilation, it could make things worse. So the best solution is to focus on slowing down the breathing rate and calming down. Middle ear and sinus problems. Our ears and sinuses are pressure sensitive, and changes in altitude can cause significant discomfort or even injury if pressure doesn't equalize properly. In the middle ear, if the pressure inside doesn't match the outside pressure, you'll feel pain or reduced hearing. This often happens during descent. The fix is simple maneuvers: swallowing, yawning, chewing gum, or using the Valsalva maneuver, where you pinch your nose and gently exhale to open the eustachian tubes to equalize pressure. Sinus problems, on the other hand, are usually tied to congestion. If your sinuses are blocked, the pressure can't equalize at all, and that can result in severe pain. The best prevention? Don't fly with a cold or allergies that affect your sinuses. And if you or your passengers experience this, Do your descent slowly and gently. Carbon monoxide poisoning. This is one of the more insidious dangers in general aviation. It's a colorless, odorless gas that can leak into the cockpit from your engine exhaust system, especially through a cracked heat exchanger. The real danger is how efficiently carbon monoxide binds to hemoglobin, 200 times more readily than oxygen. That means even a small amount can quickly displace oxygen in your bloodstream, leading to symptoms that resemble hypoxia, headache, dizziness, weakness, and impaired coordination. Your brain gets impaired, decision-making gets impaired, and different from hypoxia, for example, you will not get better by descending. If you smoke, you're already starting from behind. Your body already has a higher baseline CO level. The best defense is a good detector. There are inexpensive chemical dot detectors or more advanced electronic ones. If you suspect CO in flight, turn off the heater, open fresh air vents, and use supplemental oxygen if you have it. Land as soon as practical. And once you're on the ground, remember, carbon monoxide poisoning doesn't go away instantly. You may need medical attention and oxygen therapy. Don't think you are okay to fly just because you are feeling better on the ground. Fatigue and stress are silent killers in aviation. They can severely degrade your performance and decision-making, causing the pilot to neglect tasks and make mistakes. Fatigue can be acute, short-term from a long day, poor sleep, or illness. This is where you start to lose precision, take longer to react, and make poor choices. Chronic fatigue is worse. It's long-term and often tied to high stress, illness, or psychological issues. It may feel like you're just always tired, and it can lead to serious mistakes. Stress is different. Stress is the mental and emotional strain we all experience, and it's not always bad. For example, acute stress can actually help in small doses. It sharpens focus and response. That's the body preparing for the fight or flight situation. Healthy individuals can usually cope with acute stress. But chronic stress wears you down, affects your sleep, clouds your thinking, and leads to long-term health problems. Pilots are not supposed to fly if under chronic stress. The key to managing both is self-awareness and lifestyle. Get good sleep, eat well, manage your workload, and know when you're not fit to fly. Dehydration is one of those threats that often gets overlooked, but it can have a profound impact on your performance as a pilot. It happens when your body loses more water than it takes in, and this imbalance affects everything from your concentration to your physical coordination. Common causes include hot weather, long flights in poorly ventilated cockpits, or even just drinking too much coffee or soda, many of which are diuretics. You might not even feel thirsty until it's too late. Symptoms include fatigue, headaches, muscle cramps, tingling, dizziness, and sleepiness. And remember, mental performance declines along with physical. The solution is simple. Stay hydrated. Drink water regularly, even if you're not thirsty. Wear light, breathable clothing, especially in summer. Keep the cockpit well ventilated. And try to minimize your intake of caffeine, particularly before and during flight. Nitrogen and scuba diving. If you or your passengers have recently gone scuba diving, this is a big one to pay attention to. Flying too soon after diving can cause decompression sickness, also known as the bends. Here's what happens. Underwater, your body absorbs excess nitrogen due to the increased pressure. If you climb to altitude before your body has time to expel that nitrogen, bubbles can form in the bloodstream, spinal cord, or brain. This is extremely painful and potentially fatal. Symptoms can include joint pain, shortness of breath, dizziness, paralysis, or even unconsciousness. To avoid this, we follow strict timing guidelines. If the dive was without a controlled descent, you need to wait at least 12 hours before flying below 8,000 feet and 24 hours before going above 8,000 feet. If the dive included a controlled descent, always wait a full 24 hours before flying. If symptoms occur in flight, descend immediately and land. Treatment requires a hospital and a pressurized hyperbaric chamber. When it comes to alcohol and drugs, the rules are crystal clear. Do not fly if you're under the influence, or if you're using medication that could impair your faculties. The FAA regulation under 91.17 lays it out. You may not act as a crew member within 8 hours of consumption of alcohol, or if your blood alcohol concentration is 0.04 or higher. You also can't fly while under the influence of any substance that affects your mental or physical abilities. Even over-the-counter medications like antihistamines or motion sickness pills can cause drowsiness or delayed reactions. What works fine on the ground may hit you differently in the air, especially at altitude. Finally, you may not allow a clearly intoxicated person to board your aircraft unless it's an emergency or they're a medical patient under care. Spatial disorientation is a leading cause of fatal accidents in aviation. It occurs when your senses send conflicting information about the aircraft's orientation. Let's start with the vestibular system, which is based in the inner ear. There are several classic vestibular illusions. The leans. After being in a prolonged turn, you may feel like you're flying straight and level, and when you level out, it feels like you're banking in the opposite direction. Coriolis illusion. This happens when you tilt your head while turning, like looking down at an iPad, then back up. It causes a tumbling sensation. Graveyard spiral. If you're in a prolonged turn and roll wings level, it may feel like a turn in the opposite direction. In trying to correct it, you re-enter the turn, often tightening it and losing altitude, then pulling back on the yoke, which worsens the spiral. Somatogravic illusion. Rapid acceleration feels like you're climbing, so you may push the nose down unnecessarily. Rapid deceleration can feel like a descent. Inversion illusion. Abrupt transition from climb to level flight can make you feel like you're tumbling backward. Elevator illusion. An updraft causes a sudden vertical acceleration, making you feel as if you're climbing, leading to an unnecessary pitch-down correction. Beyond the inner ear, visual illusions are another huge contributor to spatial disorientation, especially at night or in poor visibility. Here are the most important ones. False horizon. You might align the aircraft with sloping cloud layers, terrain, or distant lights that aren't the actual horizon. Autokinesis. At night, a single light in the distance can appear to move. This can trick you into maneuvering the aircraft unnecessarily. Runway illusions. A narrow runway looks farther away, causing you to fly a lower approach. A wider runway looks closer, leading to a higher approach. Similar illusions occur with runway slope. An upslope appears that you are high, leading to a lower approach. Featureless terrain, or the black hole effect, makes it seem like you're too high on approach, which can lead to descending too rapidly. Rain, haze, and fog can all alter depth perception. Rain can make objects look farther away. Haze can make you underestimate distance. And fog can give the sensation of pitching up. Ground lighting. City lights or roads can be mistaken for runway lights, especially at night. The bottom line? When visual references are poor or questionable, rely on your instruments. If you are flying into haze or landing in an upslope runway, be aware of the illusions and try to proactively adjust your flying to counter them. And that wraps our lesson on aeromedical factors. Thanks for watching, and if you like this content, please consider subscribing. This will help us create more lessons like this.